Halo, Assalamualaikum. Saya Dr. Zurina binti Zainal Abidin dari KPJ Glen Specialist Hospital. Jadi hari ini, today we are going to talk about red eye. When to worry? Okay, because red eye is the most common complaint or symptom that patient present to any doctor, to eye doctor, to any general practitioner. Okay, ke mana-mana lah. Mata merah doktor. Okay, sekarang ni kita nak cakap perlu ke kita worry, perlu ke kita risau bila kita ada mata merah. Okay, when to worry. So bila kita datang mata merah, doktor akan tanya, the doctor will ask many questions. We take a proper history, kita tanya sejarah penyakit tu, whether ada berkaitan dengan allergy, infection. Okay, first and foremost, we will ask whether your other family members or your any other working colleagues has the red eye as well. So because kita nak tahu penyakit yang paling common red eye ni adalah kalau kita dapat conjunctivitis. Okay, and yang the most common is actually viral conjunctivitis. Okay, so when we get viral conjunctivitis, we will have red eye. We have tearing, we have slight itchiness and gritty sensation. Macam ada pasir kat dalam tu. It's like a sandy sensation inside the eye. Okay, so the picture will look like this. Okay, so this is a picture of viral conjunctivitis. It's very typical. It starts with one eye and then goes to the next eye within a few days. Okay, so we can categorize it into mild, can categorize into moderate and also severe, because if it's severe, it can last until up to 3 weeks. So the question is whether you need to be worried or not when you have prolonged viral conjunctivitis. Okay, if you are treated, you see the eye doctor and you see the general practitioner, you take the educate medication. Okay, it goes into a natural course of 1.5 weeks to 3 weeks. It's quite common actually. Okay, but of course, you as a patient, of course, you will worry. Why is your red eye is continuous? You know, after 2 weeks, it's still there. Okay, when to worry? Okay, you can be a bit worried when suddenly your eye is painful and your vision drops. Suddenly, the vision becomes blurred and it's very painful. Okay, so what happens? What happens during this time? You can actually get. Let's go to the next slide. Okay, when this happens, patient can actually get corneal involvement. Okay, so the cornea will be okay, like you see in this picture, you can get filamentary keratitis. Okay, so you can see the filaments over there, and this can cause photophobia, painful, and the vision will actually drop a bit. Okay, so is there need to worry? Okay. When you see the eye doctor, when you have these signs, when you see these signs, we will treat your eye so that it will become less painful, it will become more comfortable, and so on. And eventually, you will get rid of the disease. Okay? Okay. One of the reasons why you can actually get eye pain during conjunctivitis is you have corneal abrasion. Okay? Alright. So corneal abrasion will look something like this. If we stain it with the fluorescein, okay, you can have corneal abrasion will also look something like this, okay, and this will cause even more painful than filamentary keratitis. Okay, so what is the treatment? Okay, you have viral conjunctivitis, you have prolonged red eye, and you have corneal abrasion, or you have filamentary keratitis. Okay, is there a need to worry? Okay, let us worry about you. We will treat your eye. How do we treat your eye? Okay, if you have filamentary keratitis, we will treat you with antibiotic eye drop and artificial tears lubricant, so that we will lubricate your eye become more comfortable. The steroid is needed because it will reduce the inflammation, and you will need antibiotic to prevent any secondary bacterial infection. Okay, I know when you have viral conjunctivitis with filamentary keratitis or corneal abrasion, the whole eye will be very, very uncomfortable and painful, but we will reassure you eventually it will be better. Okay, the disease will be cured. Okay, next common question is, will I get this again? Okay, you can get it again, but not in a short period of time. That means you may get reinfection probably in a few years' time, or if in 10 years' time, or in 20 years' time. Okay, but you don't really get it immediately, like say a few months after that. Okay, all right. Another type of viral conjunctivitis which is quite common is pseudomembranous conjunctivitis. Okay, what is pseudomembrane? Okay, when you have viral conjunctivitis, you have inflammation going on in the eye. Sometimes this inflammation will cover the conjunctiva and it will form like a membrane. Okay, let me show you in this. Okay, it will look like this. Okay, you can see this white patch here. Okay, so this is what we call pseudomembrane. Okay, next question is, sometimes patient ask me, okay, can I remove this pseudomembrane myself? Okay, you don't remove the pseudomembrane yourself because it will be very painful. Okay, so when you come to us, you have the pseudomembrane, we will put a topical anesthesia and we'll remove it for you. Okay, the next question is, will it still be painful during the removal? Yes, there will be a bit of discomfort. Okay, but we have a specialized technique on how we remove it. Okay, some of the pseudomembrane is quite decayed, very stubborn, so we need to put a little force to remove it. Okay, why is it important to actually remove this pseudomembrane? Okay, because if you do not remove the pseudomembrane, you cannot get better from your viral conjunctivitis, because with the membrane, when you apply eye drop, it may not actually absorb well, and it can cause other problems like cornea abrasion. You can have pneumonia. The surface of the cornea, okay, it will cause more uncomfortable, more discomfort. Okay, so I hope all this information have alleviate your concern about having viral conjunctivitis. Okay, one thing about viral conjunctivitis, it's very contagious. Okay, how is it contagious? Okay, so most patients will wear sunglasses. Okay, first and foremost, appearance. Okay, people have to see that you have conjunctivitis with eyes. Okay, so what is the myth about this? Okay, if you see the patient from far and the patient has conjunctivitis, can you get conjunctivitis? No, unless you have touched the patient's eye or the patient has touched any surface, touch that surface, and then you touch your eye. Okay, it's actually by touching, okay, not by just airborne, by just seeing the other patient from far or from near. Okay, so that's why it's very important when you have viral conjunctivitis or bacterial conjunctivitis is that you take care of your personal hygiene. Okay, I'm sure it's very easy during this COVID-19 era that you have been practicing very meticulous personal hygiene. Okay, you wash your hands all the time. If you don't have soap, you will you don't touch your eyes, your nose, and your mouth. Okay, so this is a very good practical way of life. Okay, you should do every day. So that's why it's viral conjunctivitis or bacterial conjunctivitis is very contagious. So that's why when one person gets it, the whole family members tend to get it. Okay, probably 90% to 100% of family members will get viral conjunctivitis from one family member. Another thing is from the work colleague. Okay, so sometimes patient will ask me, none of my family members got it, none of my colleagues at work got it, but why did I get it? Okay, you don't know whether you have touched when you go to the mall or you go in an LRT or you go into the elevator, you have touched something. The patient who had conjunctivitis touched something and you touch it without sanitizing your hand or without washing your hand, you touch your mouth or your eye. So that's how you actually got it. Okay, we move on to the most common cause of red eye. Okay, allergic conjunctivitis. Okay, this is very, very common, especially among the children. Okay, so you will get the eyes will be very, very itchy and you get redness of the eyes and sometimes discharge and tearing. Okay, most commonly it happens in young boys and children, young boys, even girls. Okay, the patient will complain of intense itchiness. They feel like rubbing their eyes, and children, they do rub their eyes. Okay, and allergic conjunctivitis is a recurring thing. Okay, once you get it, you tend to get it maybe every few weeks, every few months. Okay, this is the cause of allergic conjunctivitis. Okay. Allergic conjunctivitis is usually it's familiar. Okay, if you have asthma, if you have allergic rhinitis, okay, when your nose is always running, and you have history of eczema, skin allergy, okay, then you tend to get allergic conjunctivitis. Okay. So the most common question by parents, if that child comes to the clinic with recurrent redness of the eyes, itchiness, okay, and the parents get distraught because with the treatment, again. Okay, so it's very distressing to the parents, and it's very distressing because the child tends to rub their eyes, and this causes a bit more problem because sometimes the cornea will get abraded. You have cornea abrasion due to this, and sometimes you can get shield ulcer. Okay, so and then another factor why this thing is very distressing to the parents is because it's very difficult for them to instill eye drops. To some children, they cry, okay, they refuse to open their eyes, and then if they don't get the medicine into the eyes, then the allergic conjunctivitis will just go on, and it doesn't get better. Okay, so they always say that preventive is better than treatment. Okay, prevention. Okay, how to prevent allergic conjunctivitis? Okay, so it's a familiar disease. You're predisposed to it if you have other diseases like asthma, eczema. Okay, so it's allergy. Okay, so what is the most common allergen? The most common allergen is actually the dust. Okay, when I say dust, it's not just in the air. So the dust can collapse in any part of the house. Okay, the cupboards, your bed sheet, your mattress, even your curtain. Okay, so in this area you have house dust mites as well. Okay, let's say if you live in countries like Four Seasons, you find a few, and they can also have seasonal allergic conjunctivitis. Okay, so when it's the springtime, when they have flowers and they have pollens. Okay, so these pollens will induce their allergic conjunctivitis. Okay, so when I say prevention is better than treatment, okay, so you have to know what to do. If you find that your child tends to get allergic during when they wake up, when he or she wakes up in the morning, so it might be your mattress and your bed sheet that has collected dust or your house dust mite. Okay, like dalam bahasa Malaysia we say kutu. Okay, so how do we treat it? Okay, when your child comes and keep rubbing your eye, keep rubbing on his or her eye, and then they cannot look at bright sunlight or the bright lights, and then the teacher also complained that the patients keep rubbing their eyes, cannot concentrate in school, and the patient refused to open their eyes, then you have to be a bit worried. Why? Because the patient might have shield ulcer. Okay, so this is the look of shield ulcer. Why do they have shield ulcer? Okay, because if you invert the eyelid, the patient can have this kind of appearance. This is called actually the cobblestone papillae. Cobblestone papillae is a reaction or is a sign when the patient has allergic conjunctivitis. Sometimes the papillae is not as big as this. Okay, so when it's not as big as this, we call it just papillae. Okay, but if it's big and it has the cobblestone appearance, we call it vernal allergic conjunctivitis. Okay, so what is the treatment? The treatment is anti-allergy eye drop, antihistamine eye drop, mass stabilizer eye drop, and then if it's very severe, we give mild steroid eye drop. But this has to be used with caution, and you have to be followed up regularly with the eye specialist. Okay, we have to check the eye pressure. We make sure because steroid eye drop can cause increase in intraocular pressure. Okay, and then we give a lot of artificial tears, but preservative-free types. Because if you have the normal artificial tears, sometimes it can cause more allergy. Okay, alright, so we go to the next topic. Okay, so to me, if you have viral conjunctivitis and allergic conjunctivitis, it's not a worrying thing. It causes distress to the parents if their child has allergic conjunctivitis, but it's not dangerous. Okay, when is it dangerous? It's dangerous if you buy steroid eye drop over the counter, you don't see your eye specialist, and suddenly your child develops high intraocular pressure, and you don't see. It's not is treated, and the patient has glaucoma, and this can lead to blindness. Which is more okay? Okay. First and foremost, if you have acute glaucoma, if you have cases like scleritis, and if you have suddenly your eyes become red and it's subconjunctival hemorrhage. Okay, so we go to the acute glaucoma. What is acute glaucoma? Glaucoma is a disease whereby your eye pressure, okay, you have eye pressure, you have blood pressure, okay, so these two are not the same. You have, when you say it, you have hypertension, you have high blood pressure, okay, so this is when your blood pressure is high, okay. You need to maintain an optimum blood pressure so that you don't get any other complication like stroke, heart disease, okay. Your eye also has pressure, okay, so we call it intraocular pressure. So you have your optimum intraocular pressure, which is between 11 of 10 to 21 millimeter mercury. And we, as specialists, when you come to visit us, we take regular eye pressure for you. We use this instrument, which is called the Goldman tonometry. And nowadays we have something else which is easier to use in children and in bedridden patients, which is called tonometry. Okay, so when your eye pressure increases and it's more than 21 millimeter mercury, most of the time patient does not notice. Okay, how would you know? If you go and do your eye screening and they take your eye pressure and your eye pressure is high, then you will know that you have increase in eye pressure, and we do other tests for you, and if it's confirmed you have glaucoma, we treat you. Okay, but there is a subgroup of glaucoma which we call it angle closure glaucoma, and this can present as sudden acute eye pain and redness and sudden decrease in vision. Okay, so is this worrying? Yes, it's worrying. Why? Because it is potentially blinding condition. Okay, so we have sudden acute eye pain, headache, and sudden decrease in vision. You must go to outside office hours. You must go to the emergency, and then the emergency physician will refer you to the eye specialist. Or if it's within office hour, please go and see the eye specialist immediately. Okay, because the eye pressure needs to be lowered immediately. Okay, so we go to another case of if you have red eye. Okay, so when you have just red eye and it's a bit of discomfort and you don't have any blurring of vision, okay, maybe you can hold on to see the eye specialist 1 or 2 days. But if you have red eye and you have intense pain until you cannot sleep at night, and you have decrease in vision, then it's something to worry about, okay? Because the differential diagnosis can be corneal ulcer, can be corneal abrasion, it can be scleritis, it can be uveitis, and it also can be acute glaucoma, okay? And all these are actually potentially blinding condition. Okay. If you have history of eye trauma and you have history of contact lens use, you need to be more worried, okay? Because now the diagnosis will go point towards more to corneal ulcer. Okay, we'll have a look at how corneal ulcer looks like. Okay, this. Okay, as it's written here, the major cause of corneal ulcer is actually contact lens use. So, contact lens use is actually a very, very common, I mean, almost a lot of people, especially the youngsters, they use contact lens, okay? Okay, why do you use contact lens? Okay, you use contact lens because you do not want to wear glasses. Okay, you do not need to use glasses. Why do you wear contact lens? Of course, because of cosmetic. Okay, so colored contact lens. Okay, so when you use your contact, okay, I won't say that you cannot use contact lens. Okay, if you want to use contact lens, you need to have a sound knowledge. What is a contact lens and what is the precaution and how to use it. Okay. Take care of your hygiene, and then you must learn about your contact lens. What it is a soft lens, extended use soft lens, whether it's a gas permeable contact lens, whether it's a hard contact lens. Okay, okay. When you use soft contact lens, and do not use it after the expiry date has ended. Okay, this is number one rule. Do not sleep with your contact lens. Never, never. Even to take nap during the day. Okay. Let's say you need to travel in the aeroplane, you need to travel in the bus, and you know you fall asleep. Do not wear your contact lens. Okay. Number three, do not share your contact lens solution with anybody. Number four, please take meticulous care of your hygiene. Wash your hands whenever you want to wear your contact lens. Okay, rub your eye. Okay, and that's it. Yeah. Okay, if you follow these 5 rules, we have any right. Okay, why? Why does it happen? Okay, when you sleep with your contact lens, okay, your eyes needs nutrition, and the nutrition is actually provided by the tears and your aqueous humor. Okay, so when you wear contact lens, you only deprive the oxygenation of your cornea. So imagine when you sleep, you close your eyes, so the oxygen cannot be absorbed into your cornea, so you lose your oxygenation. And your bacteria loves this. Okay, they love this condition whereby you do not have lack of oxygen. Bacteria loves it. Okay. This kind of corneal ulcer, this is actually a pseudomonas corneal ulcer. Okay, pseudomonas love the condition whereby you don't have enough oxygen and you have contact lens which is dirty, and this condition can actually you can go into this condition 1 or 2 days after you get infected. Okay, this is a potentially blinding condition. If you ever get better after this condition, you won't get your vision like normal, like before you have infection. Okay, if your vision is 6 before this, you can never get 6 again. And if you're lucky, you can get 612 or 624. If you're unlucky, you get blind. Okay, why do you get blind? Because the bacteria can eat the cornea, and you have melted cornea. You may have to go a cornea transplant surgery. If that is successful, your vision can never go back to normal again. Okay, and if it's unsuccessful, you'll be blind permanently. Okay, so please take care of yourself when you wear contact lens. Okay, so there are other cases of red eye where you should be worried about. If you have history of trauma, if you have history of trauma and you have red eye, please see the eye doctor. Okay, because there are so many things that happen. The operation, you can have corneal ulcer, you can have intraocular foreign body, the foreign body can get into the eye, you can have subconjunctival hemorrhage, you can have conjunctival laceration, you can have scleral laceration, you can have corneal laceration. Okay, so if history of trauma, of course there's always something to be worried about. you have heard of it. Okay, cases like scleritis. Okay, when you have scleritis, the eye will be red, and it's a different kind of red. You don't have much tearing, you don't have discharge, but you have intense and boring pain. The eye will look like this. Okay, it's a different kind of redness, and you have like a violaceous hue here. Okay, the most common presentation is that the eye will be very painful. Okay, so we have scleritis. We have to take further investigation. We have to take blood. Okay, we have to take chest X-ray because we have to rule out process of scleritis. Okay, it can be caused by tuberculosis. It can be caused by syphilis. It can be caused by rheumatoid arthritis, systemic lupus erythematosus. Short form is SLE. Okay, so when we have taken all this investigation and the investigation is negative, then this scleritis is not caused by anything. Okay, it's you just get it, and it's we call it idiopathic. Okay, no cause for it, you just tend to get it. Okay, my next question is high dose steroid, and you need to be seen frequently by the eye specialist. Okay, is it dangerous? Okay, if the scleritis is associated with other systemic disease like rheumatoid arthritis, SLE, okay, you need to be seen by the physician or rheumatologist. Okay, you need further treatment. Okay, if it's not treated, scleritis can cause thinning of the sclera. Okay. So that's dangerous. Okay, and it needs to be frequently treated. Okay, next, if you have uveitis, okay, most laymen they have never heard of this uveitis. So what is uveitis? Scleritis, sama macam scleritis, we need to take further investigation. We need to have blood investigation. We need to do mental test to check whether you have tuberculosis. You need to chest X-ray. Again, you have to be extensively investigated. Okay. Same like scleritis, you can have eye pain, but the eye pain is not as intense as the scleritis. So you have a triad of red eye, photophobia. That means you can look at the light, and also you have tearing. Okay. So when you have these three, you might have uveitis. And then uveitis can only be treated by the eye specialist, okay? Because we need to look at your eye from the slit lamp, okay? This is the slit lamp. This is the slit lamp. When you see the eye specialist, we have to look at your eye under the slit lamp. What is the slit lamp? It's basically microscope, okay? So you can see your eyes properly, okay? It's magnified. Okay. Most common, suddenly patient say, doctor, tiba-tiba mata saya merah. Suddenly my eyes become very red. It's not painful. I didn't rub my eye. Nothing happened to my eye. But I woke up from suddenly it's red. Okay? So it looks like this is bright red, and the patient is very comfortable, but the eyes look very scary. Okay, look at this. It's bright red. Okay. Do you need to worry? Most of the time, you don't have to worry. Okay, most of the time you have to worry because this is actually rupture of your superficial vessel at the conjunctiva. As you know, your conjunctiva has lots of tiny vessels, and suddenly it ruptures. Okay, so in some conjunctival hemorrhage, there are a few questions that we will ask you. Do you have history of high blood pressure? Is it controlled? Do you have history of trauma? Anything hit your eye? Or did you rub your eye? You have any history of coughing? There have been a history of carrying heavy stuff, okay? And do you have any bleeding diastasis in any parts of the body? That means if you have any lebam, any bruising in your body. If you don't have any of this, and if you have taken your blood pressure and it's normal, there's nothing to worry about, okay? Because it's just the tiny blood vessel at the conjunctiva. It's a very suspicious place, okay? So, this is your eyeball, this is your conjunctiva, and with any blood vessel from here ruptures, you can have conjunctival hemorrhage. It looks very scary, but it's actually no big deal. Okay? But most of the time, patients come and see us, we examine, and we reassure you. It will just go off on its own without any medication. Okay, next important question next common question that the patient will ask me, can this recur? Yes, it can recur. Some patients just recur, every few months it can recur. Okay, can we do something about it? Sometimes if it recurs too often and the patients get irritated with it, we can actually cauterize. Kita bakar blood vessel tu so that it doesn't rupture again. Okay, I think that should cover most of my topic of either whether you should worry or not. Is there any questions? Okay, I have 4 questions. Okay, Miss Sharisa Ismail. Sorry, I need to use my glasses. Presbyopia, okay? Above 40 years old, you need to wear reading glass. Is there anything to worry? No. It's just nature taking its course. Okay, Miss Sharisa, saya ask, doktor nak tanya kalau pakai lens bahaya tak? Okay. Jadi bahaya. Boleh jadi bahaya kalau you tak ikut nasihat doktor tu. Apa? 5 perkara. Jaga kebersihan diri. Jangan tidur dengan kontak lens walaupun nak ambil jam, walaupun setengah jam. Jangan pakai kontak lens yang dah expire. Jangan share kontak lens solution dengan jaga ni, insyaAllah. Okey, kalau tak boleh dapat kontak lens ulcer ni, doktor nak kena takutkan sikit. Okey, macam ni. Kenapa nak takut? Boleh buta. Okey, next question. Okey, Miss Mimi Ibrahim, boleh ke saya guna eye more kalau mata saya rasa gatal? Eye more. Doktor tak familiar dengan ubat mata eye more ni. Kalau IMO, AYEMO, yes. Boleh tak pakai IMO? Okey. Kenapa mata kita gatal? Okey. Salah satu reason is allergic conjunctivitis ataupun mata kita kering. Kalau kita pakai IMO, kalau kita pakai IMO, lepas tu rasa benda tu berkurang, dia punya gejala kalau kurang gatal dan kurang rasa pedih ataupun dia kurang rasa kering, okey, teruskan. Tapi kalau dia semakin teruk, maknanya IMO tu tak sesuai. Okey, sebab dalam IMO tu, dalam semua ubat mata kita ada preservatif. Okay, kenapa kita ada preservatif dalam ubat mata tu? Dalam ubat mata ni, sekarang ni kita ada improve preservatif. Preservatif tu untuk kurangkan toksik ke dalam mata. Okay. Kalau pakai IMO tu, gejala tu hilang, fine. Tapi kalau next question. Ibrahim, semua perempuan tanya ya. Okay, doktor, masa bangun tidur, mata saya selalu merah. Adakah ini efek saya tak cukup tidur atau tidur lewat malam? Okay, bila bangun tidur, okay. So there's few reasons why mata kita merah bila kita bangun tidur. First, the most common is bila mata kita kering. Okay, kenapa mata kita kering bila kita tidur? Sebab sekarang ni, especially kita tinggal kat tropical country ni, kita selalu guna aircon, penghawa dingin. So penghawa dingin ni dia boleh keringkan bukan saja kulit kita, boleh keringkan kita punya mata. Okay, so bila kita bangun tidur, mata kita kering, so mata kita jadi merah. Dan kadang-kadang mata kita rasa macam ada pasir kat dalam mata. Okay, so apa nasihat dia? Letaklah artificial tears eye drop, IMO ke, Sustain ke, Optif ke, kalau mata palsu mata palsu, air mata palsu, artificial tears. Kita boleh beli over the counter dekat farmasi. You boleh tanya farmasi brand mana yang okey. So, si artificial tears ada 2 jenis. Okey, dia ada yang ada preservatif dengan yang tak ada preservatif. Okey. Kalau yang ada preservatif, rupa dia macam ni, dia kat dalam botol. Okey. Kalau yang tak ada preservatif, rupa dia macam kat dalam vial macam ni. Okey. So kita boleh letakkan, taruh balik. Kalau dah So dia kurangkan kalau kita ada alergi kat dalam mata tu. Okey, lagi satu cause kalau kita baru bangun tidur mata merah is kalau kita ada alergi conjunctivitis lah. Okey, sebab kalau kita punya mattress, kita punya cadar semua ada house dust mite semua, kita dapat alergi. Okey, bangun tidur je mata terus merah. Very common. Okey, alright. Dapat risk fighting. What are the red flags for having lazy eye? Okay. Lazy eye ni dah jauh bertopik red eye tapi saya boleh jawab. Okay, lazy eye tu layman term je lazy eye ataupun mata malam. Tapi kalau scientific term tu kita panggil amblyopia. What the red flag? Okay, kita perlu worry kalau kita punya anak-anak mata dia lari. Bila dia tengok lari keluar, okay? That can be caused by lazy eye. Okay. Ataupun mata kita juling tu sendiri, off screen tu boleh menyebabkan lazy eye. Lagi satu, kalau katakan cikgu kata dia selalu salah buat kerja rumah. Mungkin sebab dia tak nampak, dia dah ada lazy eye. Okay? Ataupun bila dia tengok something, dia ada pinhole effect. Maknanya dia akan sengitkan kepala dia, lepas tu dia akan kecilkan mata dia. Okay. So mungkin dia akan ada lazy eye. Okay? So lazy eye ni adalah mata orang budak tu, dia okey, anatomically okey, okey? Dari depan sampai belakang okey, kornea dia okey, lens dia okey. Lens ni Lens ni adalah kanta kita tak ada cataract. Okey, budak kecil pun boleh ada cataract ya. Okey, kita panggil congenital cataract. Lepas tu retina dia semua okey, tak ada masalah kat belakang ni. Tapi bila kita ambil vision dia tak boleh nampak 6-6. Okey, dia tak boleh nampak 20-20 vision. Okey, lepas tu optometri saya check dia ada power tak? Okey, kita buat refraction. Dia ada power. Okey, katakan power dia minus 200 ke minus 300 ke. Bila dah letak cermin mata tu, dia masih tak boleh dapat 20-20 vision. Okey, ini kita namakan dia mata malas. Okey, kenapa mata malas? Mata malas ini disebabkan okey, kedua-dua mata tu, dia salah satunya lebih nampak lagi elok. Vision kat sini 6/12, vision kat sini 6/9. Kenapa? Sebab dekat sini brain dia belum mature. So, bila yang ni tak pakai cermin mata dan mak dia tak bawa dia pergi kedai cermin mata nak check cermin bukan tu, the parents did not go to any spectacle shop or go to eye doctor to check whether the patient has needs to use glasses. So the brain will suppress this mata yang tak berapa nampak ni. So dia keep eye. Okay. So dia akan tiada eye. Okay. Because the brain has told the kid to only look with the better eye. So dia menyebabkan salah satu mata tu jadi lazy eye. So apa treatment lazy eye ni? Treatment lazy eye ni kena pakai cermin mata setiap masa dan kita kena patch mata yang rajin tu supaya mata yang malas ni akan melihat. Okay, we will patch the eye, we will tell the patient parents to patch the eye, pakai cermin mata, patch the good eye 1 to 2 hours a day. Masa budak tu tengah aktif, bukan masa tidur. Okay, when is it active? Dia tengah buat kerja rumah, dia tengah tengok TV, atau dia tengah main game. Okay? So that's how we treat lazy eye. Okay. Last question. Okay. How much lazy operation would cost? Lazy operation would cost? My answer is easy. It depends on the eye center and depends on how it's recommended to you. Okay? Because now we have a few LASIK methods and we have a few types of LASIK machine and will promote different costs. Okay. Okay. I hope everyone has learned something during today's interview or lecture. Saya harap semua orang dapat pengajaran, dapat belajar daripada mata merah, red eye, when to worry, when bila kita nak risau, and when you need to see the eye specialist. Okay? Kalau ada apa-apa masalah mata dan you need to see any eye specialist, you come and see me. I am KPJ Lens Specialist Hospital. Saya Dr. Zurina di KPJ Lens Specialist Hospital. Datanglah buat appointment dengan saya di 03 33 798. Okey, saya pembantu saya Azmaliza dan juga Amy sentiasa menjawab telefon dan dapat menjawab soalan-soalan dan dapat buat appointment dengan saya. Okey. Ya, terima kasih. Assalamualaikum. Bye.